Did you know that migraine affects 2 to 3 times more women than men? Those affected may not need a scientist to tell them that hormonal fluctuations related to menstruation may be the reason. Research is showing a link between estrogen and a peptide in our bodies that is responsible for our ability to sense pain and processes related to inflammation. Now, humans and animals are naturally wired to seek contentment and avoid pain, right? But it's critical that we are able to sense physical pain. It's supposed to let us know that something is wrong. Ouch, I stepped on a nail, or ow, the stove is hot, or I have terrible cramps, or a pain in my chest, call an ambulance. I'm sure you can think of dozens of scenarios in which feeling pain may save your life. The human body is complex and quirky, though. Delicate biochemical processes that go on are not always in perfectly timed balance. Like making a souffle, one overstep or wrong move can wreck it. But fortunately, hormonal and other biochemical shifts in the body usually don't wreck anything, but they can cause temporary and sometimes prolonged discomfort and debility. The biochemistry of migraine and many other common health issues can be like this. Despite how common migraine is, and even though there are treatments to prevent and neutralize it, it often goes untreated, and it's even commonly misdiagnosed. Migraines are sometimes misdiagnosed as sinus headaches and vice versa, and then some migraineurs have doctors that go over the deep end, and then patients find themselves getting expensive imaging tests and other unnecessary procedures to rule out things like tumors and strokes and that sort of thing. As for migraines that are tied into a woman's menstrual cycle, they tend to be more intense, longer, and more debilitating than your average migraine and less responsive to treatment. In fact, it's thought that migraines in women are far more painful and debilitating than those that occur in men. There's no FDA-approved therapies that are specifically for menstrual migraine, but a wide range of medications do exist to neutralize or prevent migraines. And these medications that are out there may or may not work effectively for any one person. The mainstay of treatment to stop a migraine is atriptan. And so you may have heard of medications like Imitrex or Maxalt or Zomig and some others. They work by constricting dilated blood vessels, which in turn helps relieve the inflammation and pain of a migraine. Acetaminophen and nonsteroidal anti-inflammatory drugs such as aspirin, ibuprofen, and naproxen are also used. And as I mentioned, menstrual migraine is associated with a certain peptide involved in inflammation and pain sensing. This peptide is called calcitonin gene-related peptide, or CGRP. Research is underway to explore how certain new medicines that inhibit CGRP can quickly stop migraine, particularly in women. These drugs, called gepants, are also used to treat migraines, but usually given when other treatments are not effective. Some research says that triptans may be more effective than CGRP inhibitors, but time will tell. And then there's other research that shows that although gepants don't work well in men with migraine, they do work well in women. As mentioned before, though, modulating biochemical processes is a delicate and sometimes dicey thing. Although CGRP plays a big role in pain and inflammation, it also has other necessary functions so that ongoing inhibition of it can result in unwanted side effects such as worsening high blood pressure or contributing to pregnancy complications, osteoporosis, and insulin or GI problems. Education for doctors and nurses about how to improve their knowledge about migraine and other conditions is ongoing and usually delivered at meetings and online forums for doctors. That said, it's good for you as a patient and consumer to be smart and rightly informed about your health and healthcare in general. Now, there's lots of bad information on the web, but there's also many good patient education resources on the web. Also keep in mind that doctors nowadays are often overwhelmed with red tape, giving them little time to keep up with the latest advances in patient care. And when you go to see them for a checkup, they may not know that you have bad headaches or trouble sleeping or staying awake or pain here or there or a weird rash on your butt unless you tell them and can be clear about the symptoms. Then the two of you can have a chat about next steps. Remember that your doctor does want to provide the best care that he or she can.